Now we have Mr. Costa. You are now recognized for 5 minutes.
Chairwoman Maloney, Ranking Member Jordan, thank you for the opportunity to testify on HR 6909, the Pandemic Heroes Compensation Act of 2020. The ATU strongly supports the critical legislation. Transit workers need a new program for those who are injured or impacted by the coronavirus, modeled after the September 11 Victim Compensation Fund. The ATU is the largest transit union with over 200,000 members. And it's been 12 weeks now that this pandemic has been out there. And unlike others, our members have not had the opportunity to stay home and work from home. We're the workers out there that are moving the economy, keeping the cities going. And unfortunately, we are the workers that have been affected the most with the infections, which are right now over 1,000. At 12 weeks later, we still have over 1,000 confirmed corona cases. And unfortunately, 53 of our members have passed. And our concerns are it's only going to get worse as it reopens because it's obvious we're being overexposed. The sacrifices my members are making out there every day to keep front lines moving, like we've done before in 9/11, in Sandy, Katrina. We've been out there. We know what our jobs are. We know these jobs are hard. We sit there. Our members are assaulted, are spit at, are murdered. And now we're dealing with an invisible challenge out of here, an enemy we can't see every day. And unfortunately, it's going to get worse, I believe, before it gets better. The lack of PPE, we've been dealing with many problems trying to get the PPE. We just done a survey as of now, 12 weeks later, and in the midst of reopening, 50% of our agencies do not have the proper PPE. The mishandling of this from the get-go with our government and our CDC telling us the CDC telling us we did not need masks, that were certain things we didn't need and later on changed. We as the ATU believe we can't count on our government and we need to make the demands. So we have made demands of backdoor boarding, overcrowding needs to stop, and the recommendations, unfortunately, with the CDC has been ignored, and they've made changes. And unfortunately, those changes, I believe, are going to put our members in harm's way. So I urge the committee to look at this. It's funny, you call us heroes. You're calling our members heroes. But when we get to the table, we're zeros. It's just, it's crazy here. We're in negotiations right now in some areas, and we see this happening. So I hope you remember our members out there. I hope you remember our fallen, and I hope you help us keep our members safe moving forward as we open the cities that need to be open and need us out there to bring our cities back. Thank you very much.
Question is for Mr. Costa. This region is the most public transportation dependent region in the country. Now, I know I speak for other members who are increasingly dependent on public transportation. We have electric buses coming on, and with climate change, more and more regions of the country are turning to mass transit of one kind or another, not to mention climate change itself, which has become central to a bill, and maybe one of the few bills that will pass this session. I am subcommittee chair of the committee that has just written a new transportation and infrastructure bill, which is likely to go to the floor this year. So my question is for Mr. Costa about public transportation with the dependence of the country increasingly on public transportation. Not every region is set up to have trains of the kind we have in the nation's capital. And so buses, increasingly electric buses, are becoming more important. So I would like to know what you are experiencing as the difference between the effects of the virus on bus and train drivers at the moment, Mr. Costa.
Bus operators are much more social distance.
The bus drivers are more exposed. Of course, it's a smaller vehicle, and the airflow on it and the filterized system needs to be redone. We need to look at that, especially on the reopening, because the airflow comes from the back. So we need to put a better filterized system in there. As far as trains, we are concerned there too with the airflow. As like in New York, they have made some changes there with the filterized systems and the UV systems they're putting in, because let's face it, even though they're in a compartment, when you open up that compartment and shut it with a lot of passengers on and the overcrowding, there's still a concern. So more of our exposure that we found is, of course, is on bus, but even the maintenance area early on with the cleaning the buses, we had some of our maintenance members pass away also, contracting the virus just by cleaning the buses because the poor leadership in the PPE that wasn't given or educated to our members.
Mr. Costa, it looks like you're saying whatever decisions are made to reopen in a gradual way, that we ought to look first to transportation to see if the necessary steps have been taken there. And I would like to say to the chair of the committee that I believe it would be useful to speak more specifically to our transportation operators, about which I have not heard a great deal as we talk about reopening. Because reopening, it seems to me, cannot occur unless our workers are able to get to work. And the testimony I've heard today from Mr. Costa does indicate that more needs to be done. Is that the case, Mr. Costa?
Yes, I am very concerned that I don't have to make any more phone calls going forward after 53 of my members have passed, co-workers and friends of mine. Most recently, one from Newark, New Jersey, and New Jersey Transit over the weekend. So there is a big concern, and I just hope the industry and APTA gets this right. I mean, the airflow is a big problem. We're going to have, the CARES Act helped. We kept the service on the road, which helped us with overcrowding. And now that we open up, we need to be cautious because we did experience, I believe, the most that have passed away so far is in the transportation area. So yes, I'm very concerned with the reopening, and I hope everybody moves slowly and gets input from the transportation unions and operators at the table, and not just making determination as many of the management people are sitting home, unlike us on the road moving the country.
Thank you, Ms. Norton. Your time has expired.
I did want to specifically address some questions to Mr. Costa. I want to thank you for your advocacy on behalf of transit workers across the country. The ATU is a very effective organization in speaking up for those concerns, and I'm proud that your international headquarters is located in Maryland's 3rd District, which I represent. The frontline workers that you represent are a little bit different from other frontline workers in the sense that they are the folks that transport a lot of those other workers. So in a sense, you intersect with this conversation in two ways, and I want to thank you for what your members do every single day. We know that there's been a lot of layoffs as a result of the pandemic, and we know that, for example, in Washington, D.C., the ridership is down 95%. on the metro. They're losing $50 million per month during the pandemic. Across the country, we know bus drivers and rail workers are being laid off. Could you speak to that a little bit, what the economic impact just on your workforce is? We talked about a lot of the safety issues, but if you could talk about just these layoffs and cutbacks, I would appreciate it.
Yes, thank you for the kind words. Yes, we are our headquarters in your district, but thank you. As far the CARES Act helped a lot in keeping the buses running, and I believe, as I said before, keeping the overcrowding from happening. Our membership is down about 10%. We've lost in furloughs or layoffs at this time due to the pandemic, and matter of fact, in this area, is not, you know, as the states are opening up, we are seeing overcrowding starting to happen and more getting on the bus, which I voiced my concerns about that. But about 10% have left. The private sector is hurting us more. It seems like they didn't take advantage, or actually they're taking advantage the wrong way. They're not doing the right thing with the CARES Act money, and they're trying to basically utilize that money to put in their pocket or offset costs for profits, instead of doing like many of the public sectors did, where they brought they listened to us and we educated them on what that bill meant, and by keeping the buses and the workers at work to keep the economy going and keep it stronger.
I'm sure that you are very apprehensive about what's coming as we get closer to July 1st, which is the date by which most states and most municipalities have to balance their budget across the country. As you know, the HEROES Act is trying to bring significant assistance to state and local governments in terms of their budgets. Clearly, that will have an impact, a ripple effect on your workers. So I assume that you are strongly in support of the HEROES Act and bringing that assistance to bear.
Listen, the budget crisis for the authorities is there. They're going to need help, and once again, I hope our representatives and our Congress and Senate does the right thing for the American jobs that are here, and focuses on operating assistance to keep the agencies afloat until we get out of this crisis and bring the cities back. So yes, in the HEROES Act, as I said before, very few of our members have a good insurance policies, and this would help offset the 53 members that I have, not to mention the TWU in New York, which is over 100 members that have passed to the COVID virus, would help their families and remember our fallen heroes that kept the lines going, and keeping our nurses and doctors in there to help our country and our families stay alive.
Mr.
Thank you.
Sarbanes,
Thank you very much.
the time has expired. Thank you, Mr. Sarbanes. Thank you. Any other panelists want to answer the question before going to the next?
I'd like to say something.
Great.
This is John Costa, and yes, I think it was shameful that our government dropped the ball. It did not, and this president did not enact the Defense Production Act for all that in this country that went on the front lines for the nurses and the doctors, and I believe we could have saved many, many more lives. When this happened, we did our own. We took care of our own. And what should have happened here, we should have taken care of our own. We need to go forward and take care of our own and make sure we produce it here and put people to work here to protect ourselves. Shameful, this president, this administration let so many people die on the fact of not having the protection that was needed, and then later on said we needed it.
Thank you, Mr. Costa. Any other panelists?
If you didn't have your workers to go out on the front lines as they do in public transportation, can you tell us some of the ways that you believe that would have impacted our ability to fight the virus in this country?
Well, many of our riders don't make a lot of money, and many of them are the janitors that clean the hospitals. Many of them need to go to grocery stores. Many of them need to go to dialysis and to the hospitals for treatment, as far as the paratransit and mobility service we have. So if we were to completely shut down, people would die.
So much, and thank you so much for the panelists for being here. I want to always center on people in my district and those directly impacted. So I want to share this photo of Jason Hargrove, a Detroit bus driver, posted a video on his Facebook where he expresses frustrations about the unsafe conditions on the bus, including passengers coughing. He posted that video of himself wearing the mask, as you saw, on his bus with the captions, "I can't stay home. I'm on the road for you." Just 11 days after posting his video, this 50-year-old father of 6 died of complications of COVID-19. Mr. Hargrove's story highlights the dangers that our transit employees are facing and other frontline workers, as you all have been hearing. So I want to ask you, Mr. Costa, when I hear Mr. Hargrove's story, the first thing I want to do is start protecting people right away and try to adjust that. But when you hear some of my colleagues and some of the rhetoric coming out about opening up the economy, what do you hear first? What is it? What is the first thing you're thinking about when people ignore Mr. Hargrove's story and so many transit workers on the ground? When you hear people, we have to open up the economy. Can you answer that question?
Yes, I think of Hargrove. He was a hero. He brought the transportation workers to the front and this pandemic to light about how our government failed us and did not protect us. And that's my fear of how many more Hargroves are we going to be faced with if we open up without having being prepared. I mean, I'm listening to somebody tell me one thing, but I'm understanding that, as these states are opening up and nobody's using PPE, I don't know, I watch the news too, and I read the news, and it seems like there's more people getting sick. And it is right now, I'm from Jersey, and I'm in Maryland right now, it's 90 degrees. All week it's been, it's not like February anymore. But, we need to move slowly. And we have to be very cautious because our operators, as I said earlier, over 1,000 are still infected that we know of. Many are quarantined. If they're on the buses, they're spreading it to our front line, our grocery store workers that are on these buses, our frontline doctors and nurses that are on these buses. Are we doing the right thing?
That's right. No, thank you, Mr. Costa. I really appreciate it.